Thyroid. When your TSH levels increase more than the normal, you are diagnosed as having hypothyroid. TSH means thyroid stimulating hormone. Since your thyroid gland is not functioning properly, the blood is sending more stimulation to the gland via the thyroid stimulating hormone so that it will function better. Now, your doctor will order a TSH test for you if you tell him the following: that you're putting on weight, that you're having hair loss, dry skin, itchy skin, you're constipated, you're feeling fatigue, very tired, you're feeling low or depressed, you are having puffiness of the face, muscle weakness, increased sensitivity to cold, hoarseness of the voice, heavy or irregular periods, etc. Now, one need not have all these symptoms. It could just be one or two symptoms to begin with. And all these major symptoms, they appear only when the TSH levels are very, very high, and that too for a prolonged period of time. Nowadays, hypothyroid is diagnosed by the patient themselves, and the only symptom they look for is weight gain. The moment there is weight gain, the patient themselves go and get themselves tested for thyroid. Now, let me discuss with you certain facts about the TSH. The normal TSH levels are allowed up to 5. Now, let's say it goes above 5 up to 15. It means that there is a strain on the thyroid gland and it is not producing its hormones properly. It does not mean that the gland has stopped to function. When the gland stops to function, the TSH level goes all the way from 350 to 400. When you go to the doctor with a raised TSH level, he will put you on synthetically produced thyroid hormone, which will naturally collect the blood levels, thereby bringing down the TSH levels. The problem is when you are put on these medications at a low levels like TSH of 15, the activity of the gland is contained as it is not getting any more stimulation from the blood to produce, and the body gets used to the artificial hormones that are given. This is the reason that once you are on a thyroid medicine, you have to take it all your life. The key to the treatment of hypothyroid is to continue to stimulate the thyroid gland. The treatment being given is for the effect, that is the raised TSH. But the cause of the problem is an underactive thyroid gland. That is not being treated here. Hence, there can be control, but no cure is possible. Here is where homeopathy can help. Homeopathy has very effective medicines to stimulate the gland. If used over a period of time, it can help the underactive gland to function normally. If a combination of homeopathy and allopathy is used, the homeopathy treats the cause, that is the underactive thyroid gland, and the allopathy treats the effect, that is the raised TSH. Thereby not only affecting better control, but possibly a cure. As the levels get better, the allopathic medicines can be tapered and eventually it can be completely stopped. We at our clinic have treated more than 14,000 patient visits for thyroid, and we have had some excellent results. Apart from using a combination of homeopathy and allopathy, there are other things that can be done to get the thyroid to function normally. Number 1, eat wisely and in moderation. Never overeat. Number 2, drink plenty of water. Our body is over 70% water. The water balance in the body has to be maintained. So you have to drink plenty of water whether you like it or not. Number 3, get abundance of sunlight. Sunlight is very, very important for our existence. The heat in the body that is required for the normal functioning comes from the sunlight. Sunlight has many other benefits too. So get abundance of sunlight. Number 4, and very important, is pranayama or breathing exercises. The reason you do pranayama is because we regularly on a day-to-day basis go through multiple emotions. Have you noticed that every time you go through an emotion, your breathing also changes? So it's very important to correct your breathing. So that correction of the breathing can be done by doing pranayama for a few minutes every day. If you can follow these things with a combination of homeopathy and allopathy, your thyroid will not only be in control, but you could even be cured of it over a period of time. Personally, I have been diagnosed with hypothyroid some 25 years back. My TSH was detected to be above 100. And I took allopathy for a year or so, and then it came in control. But slowly, over a period of time, I just followed the above steps, and it's been over 20 years plus. And I'm off allopathy and my TSH has always been normal. Take care.